My name is Carrie Fox. I am with Lakeview Health. I'm the marketing director here, and we are going to get started on today's webinar, Treating the Addicted Self, a Developmental Approach to the Imposter Syndrome. A couple of things before we do get started. A little bit about Lakeview Health. We are a multi-site addiction treatment program. We do have our location, we're in Jacksonville today, and at the Jacksonville site, we have gender-responsive treatment and a continuum of care ranging from medically monitored detox all the way through intensive outpatient programs. Our board-certified physicians partner with our clinical team to address the core reasons someone is actively using and help each patient set a new course for recovery. We are dual diagnosis center and help adults who are willing and ready to recover. Our credentials include Joint Commission accreditation as well as having our FAR and NAR certifications. We're members of NATAP and NADH. And a little bit of housekeeping for the webinar. Sorry, having a little issue with the slide there. We do welcome questions, so that you'll see a question panel on the side of your screen. Go ahead and answer and put in the questions, and we'll answer those at the end of the webinar. And then we do appreciate your feedback. So within 60 minutes after we complete this webinar, we'll go ahead and send an email to you that will include the evaluation to tell us all about what you thought about the webinar and how it will help you in your practice, as well as a post-test. When you complete the post-test, you will have the ability to download the certification for this. We do offer 1 CE with this, so you'll be able to download that. But if you miss that opportunity at the end of the post-test, don't worry. We will also send you the certificate in a follow-up email a little bit later this week. So with that housekeeping done, you can see that we do have upcoming webinars in October and November, so I hope that you can join us for those too. And moving on to get to the focus of today's webinar, I want to tell you a little bit about Philip Warrick. He is our presenter for today. He received his undergraduate degree from the University of Central Florida prior to earning his master's degree from University of South Florida in counselor education through the mental health counseling track. He is a licensed mental health counselor pursuing his master's certified addiction professional, and he's been working with Lakeview Health since 2016. Prior to Lakeview, he gained experience in the field while working as a substance abuse counselor at an inpatient facility in Tampa, Florida, focusing specifically on treatment for professionals in the medical field. He also served as a field therapist in the Orlando area, working with children struggling with dual diagnosis, mental health, and substance use disorders. So I'm very excited to just change seats here and welcome Philip.
Absolutely. Thank you so much. All right. Well, I appreciate that introduction. And just because of the timing of today, I'm going to try and jump right into it. And again, like Carrie said, we will have some time. My plan is to save some time for the end so that we can answer any questions that you might have and kind of take care of some stuff there at the end. Again, you will be getting an email after the webinar is over with some additional information. So I'm going to jump right into it. Hopefully I don't go too fast for anybody, but there is a significant amount I want to cover. We don't have a whole lot of time. So starting with the kind of the plan for what we're going to do today, the focus is going to be on imposter syndrome and the key components. What we'll do is we'll look at how imposter syndrome develops from early childhood or how it can develop later in life through some sort of triggering event or something like that. Then we'll switch gears a little bit and change focus to looking at the relationship between imposter syndrome and substance abuse. And that's something, especially with my experience as a substance abuse counselor here at Lakeview and prior, something that I've seen quite a bit of is that relationship between imposter syndrome and people struggling with substance use disorders. Then we'll continue to look at imposter syndrome and how it manifests itself in treatment, how we can identify it, and the importance of identifying it for that matter. And then lastly, we'll look at some obstacles, clinical implications for working with this particular population. We'll look at some strategic interventions, therapeutic approaches, things like that. So before we get started with talking about imposter syndrome, I wanted to look at what an actual imposter is so that we can contrast that a little bit with imposter syndrome. So what I've done here is chosen a couple famous imposters throughout history. It's kind of fun to look at these. The first one would be Elizabeth Bagley, aka Casey Chadwick, who was infamous for defrauding several U.S. banks out of millions of dollars, claiming to be the illegitimate daughter and heiress of Andrew Carnegie. Next, we have Frank Abagnale. Most of us probably know who he is, made famous by the movie Catch Me If You Can. He's now a security consultant, but prior to that, between the ages of 15 to 21, he was a confidence trickster, check forger, imposter, pretending to be everything from a pilot to a lawyer to even a surgeon at one point. After that, we have David Hampton, a film and a movie made after this particular person, 6 Degrees of Separation. He was an American con artist and robber, became famous in the 80s after he managed to convince a few wealthy Manhattans to donate money to his causes. And then lastly, we have Ferdinand Waldo de Mara, also known as the Great Imposter. And he was famous for masquerading as a plethora of different personalities, everything from a monk to a surgeon to a prison warden at one point. The unique thing about actual imposters is that they tend to struggle with a lot of characteristics of somebody who has antisocial personality disorder. So you see things like failing to conform to social norms, recklessness, lack of remorse, impulsivity, deception, lying, things like that, which is going to be in stark contrast to what an actual imposter, somebody who has imposter syndrome, what they struggle with. So now we know what an imposter is. We'll switch gears and we're going to look at what an imposter syndrome is. And so I have a couple of fun little pictures here that kind of summarize what I'm talking about. The first one being, all these people really seem to have it together and I still have no idea what's going on. And of course, everybody feels a little bit of that at some point in their career. And then the next picture is the fox in with all the hounds. So what is imposter syndrome? Well, first off, it is not an actual syndrome. It won't be found in the DSM-5 or anywhere like that. However, a lot of the symptoms of imposter syndrome are in the DSM-5, like anxiety and depression, things like that. So if we look at the actual definition of imposter syndrome, it's a collection of feelings of inadequacy that persist despite evidence of success. Highly achieving individuals marked by an inability to internalize their accomplishments and the persistent fear of being exposed as a fraud. The term was actually coined in 1978 by clinical psychologists Pauline R. Clance and Suzanne A. Imes. And again, it's the idea of like, despite all this external evidence of their competencies, these people still feel like they're a fraud on the inside. They feel like they're trying to get away with something, or they can discredit positive feedback as being the result of luck or circumstance or effort, having to put in a lot of extra effort to achieve the same success that someone might be able to do with half the effort. So they find different ways to kind of discredit positive feedback, still considering themselves to be a fraud in one way or another. So now we know a little bit more about what imposter syndrome actually is. I want to look at actually how prevalent it is. And if we look at this slide, we can see that as many as 70% of people feel like an imposter at some point in their lives. Research even suggests that as many as 2 out of 5 successful people consider themselves to be frauds at some point in their career. And then women and certain minorities actually struggle with higher rates of imposter syndrome. And we can actually talk a little bit later on about why that is, why women and certain minorities struggle a little bit more with imposter syndrome. There are quite a few famous people who have come out and shared their experience with imposter syndrome. And so I thought it'd be interesting to pull up a few of those sure I could share how some of them have struggled with it in one way or another. So here we have Tom Hanks, and this is the quote that he has. Look, the title is Lucky Guy. It's about somebody who is almost good enough to deserve what he achieves. And I understand. I still feel sometimes that I'd like to be as good as so-and-so actor. I see some other actors work, and I think I'll never get there. I wish I could. And of course, that's coming from Tom Hanks, who some people would say is one of the best, if not the best actor, depending. So next we have Chuck Lorre. He's famous for The Big Bang Theory, 2.5 Men. He's written quite a few shows on television. And his quote is, when you go and watch a rehearsal of something you've written and it stinks, the natural feeling is, I stink, I'm a fraud, I need to go and hide. So again, he's expressing some of those same symptoms, that negative self-talk that we see a lot in people with imposter syndrome. Next we have Emma Watson, famous from Harry Potter and a few other, The Perks of Being a Wallflower. She says, when I was younger, I just did it. I just acted. It was just there. So now when I receive recognition for my acting, I feel incredibly uncomfortable. I tend to turn in on myself. I feel like an imposter. It was just something that I did. And with that quote, it's kind of unique in that we start to see how imposter syndrome can develop as a result of your childhood. And that's something we're going to look at pretty closely as we go through and see how it develops. We'll focus in on the childhood and some of the aspects of parenting that can contribute to the development of imposter syndrome. Next, we have Sonia Sotomayor. She says, it is very, very difficult coming from a background like mine, seeing how writers talk about how different you are from the others, not to feel a bit intimidated, not to feel some of the imposter syndrome. So here she even talks about the imposter syndrome. This is an interview she did some years ago where she remarked on the imposter syndrome and how it's affected her throughout her career. And lastly, we have Maya Angelou, who states, I've written 11 books, but each time I think, uh-oh, they're going to find me out. I've run a game on everybody, and they're going to find me out. So even somebody as renowned as her for her work can still struggle with some of these feelings of being an imposter, being a fraud, despite evidence that she's highly successful and has achieved so much in her lifetime. So let's look at a different way to kind of describe what imposter syndrome is. If we look on the left there, we see the imposter syndrome. So the blue circle there, it's what I think I can do. And in the bigger orangish circle, we see what I can actually do. So it's really doubting our abilities, not having confidence in our abilities. The opposite of that would be overconfidence. And of course, this is not the goal. We don't want to take somebody who's struggling with imposter syndrome and try and get them to be overconfident. We want to find that balance. We want congruency so that what they think they can do matches what they can actually do. Overconfidence would be what I can actually do being a lot smaller than what I think I can do. And of course, that's not the goal. In fact, this next slide will show us a little bit better about what we're going for. So again, on the left, we have somebody with imposter syndrome, what I know, what I think other people know. And then on the right, we see that congruency. What I know is equal to what other people know. So it's that idea of, I'm here today and I can offer something to you all. We can talk about imposter syndrome. Hopefully you all can gain something out of this. But I'm very aware that you all have something that you could provide me as well. There's a lesson that you all could teach me or something that you could show me. And there's that equality there with that. That's kind of the idea when we're trying to treat imposter syndrome, get them to that understanding. So now I can tell a little bit about my story and my struggles with some of the symptoms of imposter syndrome pretty early on. This is actually a picture of me on graduation day from USF 6 or 7 years ago. That's my graduating class, and I'm there on the left, obviously. And as I took my first job in the field, I went into it with a lot of those symptoms of imposter syndrome. You know, this feeling of I don't know enough. I'm not going to be able to help people. I doubted my abilities a lot, and it caused anxiety in my life. Not to the level where it was causing significant distress, but certainly to a level where I was experiencing heightened levels of anxiety as a result of that. And then, of course, as I got more comfortable in the field, I was able to overcome some of those things. But what was interesting is, when I would get positive remarks or a positive evaluation or something like that, I very much summed that positive feedback back to being luck or having thoughts like, oh, man, if they only knew the truth, they would never say that kind of stuff. And so, again, I was exhibiting a lot of the symptoms that are so common in people that struggle with imposter syndrome. And then, of course, as I transitioned, I got some years of experience. I got licensed. All of a sudden, I started to feel more comfortable, more confident. And I didn't allow that imposter syndrome to cause significant distress in my life. However, it can, and it very much can. And a lot of the patients that I see with who I'm working at, who I work with at Lakeview, and who I've seen in some of the past jobs I had. Interesting enough, for those of you that are interested, the female that's directly next to me, her name is Mia, and that is my fiance, and we're actually getting married in March. So that's just a little information for you guys, I guess. So let's take a little closer look at some of the key features of imposter syndrome. So we'll start with the traits. Low self-esteem is a big trait of imposter syndrome. If we break down low self-esteem, we can usually identify fear and anxiety as the cornerstones of low self-esteem. And so somebody with imposter syndrome is going to struggle a lot with that fear and anxiety. And most of that fear and anxiety derives from the thought of, I'm going to be caught. I'm going to be called out as being a fake or a fraud. I know I don't know what I'm doing, even though the reality is very different from that. We also see introversion. Again, that's a symptom of depression as well, but you can be drained by social settings, And then neuroticism, long-term tendency to be in a negative emotional state, experiencing feelings like anxiety, anger, depression, things like that. And then the last one is attributing success to external factors. That one right there is a key component of imposter syndrome, finding different ways to dismiss any kind of positive feedback that you receive. And then some of the psychological factors, again, we have anxiety, we have depression, and then we have distress. And as we know, when I was struggling with some of these symptoms, the stress level did go up. And I attempted to use that stress as motivation to learn more, to engage more, to try and break through these feelings. When the stress gets too overwhelming, that's when it can become distress, and it can have some really negative consequences in the performance of an individual. So now we know some of the key traits. We're going to look at the imposter cycle in action and see how it's going to kind of play out. So if we have a scenario, and we'll start in the top left there with the achievement-related task. So if somebody gives you an achievement-related task, like come up with a webinar to present to some individuals, for example. You get the task, and the first thing that comes to mind is, oh my gosh, anxiety, self-doubt, and worry. I'm not going to be able to do this. I feel overwhelmed. I don't know what I'm going to be talking about. All these feelings start to fill in, become kind of overwhelming. So then we see it branch off down below that. And there are two options. We can either go the over-preparation route, or we can go the procrastination route. And both of these will have some negative consequences, which we're going to look at on the next slide. But either way, we're going to take one of those options, and then we're going to present the webinar. So we're going to accomplish the goal, present the webinar. We'll have a feeling of relief. We can take a deep breath. We can say, okay, it's over. At least it's out of the way, and I don't have to think about it anymore. And then we'll get some evaluations back, or we'll get feedback from whoever was watching the webinar, and they'll say, you did a great job. It was awesome. Well done. And then, of course, I would discredit that positive feedback. And in the case of procrastination, I would say I got lucky. I don't know how I'm getting this positive feedback, but it was luck. In the case of over-preparation, I would say, oh my gosh, I had to put in 3 to 4 times the effort to accomplish the same goal as somebody else. They could have put in half the time and still gotten the same positive feedback as I am. So in either case, I'm finding ways to discredit that positive feedback, which of course is going to reinforce that belief that I'm a fraud, or on the bottom left there, reinforce that perceived fraudulence, which will work to increase that self-doubt, feed into the depression, feed into the anxiety, and then I get another achievement-related task to complete, another webinar to do in a couple months or something like that. And then we see that cycle just continue over and over again until some sort of intervention happens to help the person out. So let's look a little bit closer at over-preparation and procrastination and some of the side effects of both of those things. So if we look at over-preparation first, what happens if we get that task and we decide that we're going to go that over-preparation route? Well, it can lead to burnout. Again, that emotional exhaustion, having to put so much time and effort and energy into the task that you're doing. It can lead to frustration, anger, irritability, or maladaptive behaviors. We see a reduced happiness or the early stages of depression. It can lead to isolation, which of course can do two things: exacerbate the depression, but also alienate your support system. And then that leads to poor life balance as well, which will be further alienation. You know, if the goal of our, when we're working with our patients, is to provide them or guide them in a way that leads to that good life balance or healthy life balance, over preparation is going to work to do just the opposite of that. It's going to create poor life balance. We pour way more time and energy into our work life, and we ignore, in the case of patients that I see here, we see them ignoring their recovery responsibilities, going to AA meetings, meeting with their individual therapist, following through with those obligations. And you also see the poor life balance in family as well, spending so much time at work and not spending enough time at home with family or engaging in hobbies with family or friends, which can lead to that burnout pretty quickly. So the opposite end of that would be procrastination. So if we took the other route, we decided to procrastinate on the task, it's going to lead to increased stress. And we see that, again, a lot. In fact, I was working with a patient just recently, and it was something as simple as completing a task in between sessions with this individual. And he chose to wait until the very last day to even start working on the assignment. And I was talking with him about it and why he chose to do that. And he found out that every day he waited to do it, his stress level increased because he was waiting and waiting and waiting, and he knew the due date was getting closer and closer and closer, and his stress level was growing and growing and growing as a result of that. That's something that we see quite a bit, and it's quite common with the population at least I work with. That, of course, can lead to a decrease in happiness. Procrastination can also be a very big self-sabotaging technique. We're actually going to talk about that a little bit more. Another self-sabotaging technique outside of procrastination can be substance abuse, as a way to self-sabotage oneself. That leads to lower self-esteem, and of course, in terms of the workplace or the work environment, it can make somebody very non-competitive. We're constantly procrastinating on things and not turning them until last minute. Of course, that's going to make us pretty non-competitive in the work environment. So we know we looked at the imposter cycle. We've looked at what imposter syndrome is. How do we identify it in an individual? Well, there are a couple ways to identify it. Again, I put these scales up here kind of as reference and something that we can look at. However, I have found that in working with patients just through talk therapy, cognitive behavior therapy, asking the right questions, we can usually discover some of the features of this imposter syndrome without having to utilize the scales, although these scales can be very helpful. So the first one is the Harvey Imposter Phenomenon Scale. This one was created in 1981. It had a few problems. It was only a 14-item scale. It was designed to measure the presence and cognition of the imposter phenomenon. The problem was the assessment used poor wording, and it resulted in quite a bit of inaccurate reporting. So it was not super reliable. That's why in 1985, the Clamp Imposter Phenomenon Scale was created. And this was created by Pauline Clamp, so they coined the term imposter syndrome. And this is sort of the gold standard in terms of assessments that we can use for imposter syndrome. This one's a 20-item scale, and it uses it's a Likert scale, and it proves most reliable in being able to identify imposter syndrome within individuals. Again, it basically focuses on identifying those three areas: feeling fake, discounting positive feedback, and finding justifications as to why you don't deserve that positive feedback. So in that case, it would be luck. There was another one that was created in 1995. That one's called the Perceived Fraudulent Scale. It had pretty congruent results in terms of identifying imposter syndrome with the Clance imposter phenomena. The only issue that I have with it, and that I found with it when I was doing the research, is that it is a 51-item Likert scale, so it's significantly longer, and it really produced very similar results to the middle one there, the Clance imposter phenomenal scale. And so most people tend to use that middle one, since it is a little bit shorter and still just as reliable. So that begs the question: are you an imposter? And of course, we know what an actual imposter is, so hopefully nobody listening is an actual imposter. But does anybody struggle with imposter syndrome or some of those characteristics of the imposter syndrome? So what I did is I pulled some of the questions from a really short assessment tool used to assess for imposter syndrome. This is not one of the three scales that I was showing you a few slides back, only because we don't have the time for me to put all of them up there. I can add a link actually into the email to take you to the actual Clance phenomenon scale. That won't be a problem. But for time here, I figured it would be better just to put this in there. It's not going to be as accurate or detailed, but it gives you a good idea of some of the questions that can be found on the actual one that Clance wrote or created. So what I'll do is I'll read these questions, and if you kind of want to play along at home, you can answer them. It's only three different options. You have one, very rarely; two would be sometimes; three would be almost always. And if you add up your total score at the end, I'll be able to kind of provide you with a little score, and we'll see how you did. So number one is, you feel that you have fooled people in some way, or have given the impression that you are more capable than you really are. Number two would be, you feel that your achievements are mainly down to good luck, other people's help, or the achievements weren't that big of a deal anyway. Number three, you find it hard to understand or accept how someone like you could be in the position you are in or doing what you were doing. Number four, when you achieve something, for example, a qualification, a good result on a test, or a job promotion, you feel that there must be some sort of mistake, maybe a clerical error or a computer error. Number five, when you make a mistake or something goes wrong, you feel worried that this could expose you as a fraud or prove that you don't know what you were doing. Number six, despite your achievements, you feel that at any moment someone will come along and tap you on the shoulder and say, "We need to have a chat, you don't belong here." And last one, number seven, you find that each new success or achievement, instead of being a source of satisfaction, just increases the pressure to achieve the next time. So those are the 7 questions, and if you were answering them to yourself at home, I'll go ahead and read how the scoring works with that one. If you add up all your scores and you got between a 1 and a 7, it's pretty unusual. It indicates that you rarely doubt your achievements and you don't spend a lot of time wondering whether you are a fraud or not. If you got an 8 to 14, that's typically the most common response range. That's where most people fall. Most of us will experience some imposter feelings from time to time, perhaps in a new situation or when you're going to be evaluated. The more often you experience them, the more potential they have to impact your life. And then the last section is 15 to 21. If you score that high, you quite often question your abilities and achievements, and feelings of being a fraud are quite common. Imposter feelings are causing you some worry and probably have an impact on what you think, feel, and do. So that's a little example of one of the assessments and how the scoring system works for them. It can be very useful. Again, through talk therapy, you can usually identify a lot of the characteristics of imposter syndrome without having to utilize one of these scales, although they can be very helpful when working with working with patients. So I want to look at the development of the imposter and how a person's upbringing can actually play a role in the development of the imposter syndrome. So let's look at some of the key characteristics of that upbringing. And we're also going to dive into schema therapy too, and look a little bit at those early maladaptive schemas and how they may play a role in the development of some of these traits of imposter syndrome. So the first thing is upbringing does play a role. The first one would be undeserved praise. So if your parents or significant adults in your life gave you acknowledgement for things you didn't think you deserved praise for, you might have been instilled with this sense that you are a phony. If you very early on, if you were told you're a good girl or a good boy frequently, you were applauded for skills as a math star or a really good athlete, but you knew based on your comparison to your peers that you weren't particularly distinguished in that area. In some of those cases, you may start to think of your output as, and ability as somewhat of a sham. So that undeserved praise, especially repeated undeserved praise throughout your childhood, can play a big role in that development of feeling like you're a fraud. Next, you have no praise at all. So this is the exact flip side of the undeserved praise. If you don't receive any praise at all, even if it's for something very impressive, straight A, batting a home run, scoring the most points in the game, whatever the case may be, you probably learn to think of yourself as inadequate or rarely up to snuff. Everyone from the youngest child to the most mature adult requires some sort of praise and nurture in order to build up their self-esteem and sense of worth. And so if they don't receive any of that throughout their childhood, we can see how that sense of worth and that self-esteem can be very, very affected as a result of that. Next, we have lack of entitlement. So if you were disciplined as a child using language such as your brother gets to do this because you didn't do this task, or your sister gets to go here because you didn't do this. That constant kind of belittling and putting down, it can have a big effect on a person as they transition through the stages of change in childhood. It might have spoiled a person's understanding of what it means to truly deserve something. So they get a skewed idea of what it means to truly deserve something. And you see at that bottom bullet there, they develop this mentality that maybe I'm not deserving. Maybe I'm not a deserving person. Which again can feed into the depression, feed into the anxiety and the self-worth. That second to last bullet talks about family labels. If we grow up in a dysfunctional family especially, and we see those family labels come out, I'm sure a lot of us are familiar, the lost child, the scapegoat, the hero, the sensitive one, the competitive one, so on and so forth. The danger of those family labels is they can be hard to shed, even if a child's behavior and disposition adapt away from that defining perception. If they were defined as the lost child growing up, they're going to carry that into adulthood, even if that doesn't match the reality of what they're capable of doing. I mean, all those things kind of lead to that bottom one, which is that belief that I'm not deserving or I'm a fraud in that sense. So let's continue on looking at the upbringing. And we're going to look at early maladaptive schemas. So here we have the 18 early maladaptive schemas, and there's one in particular that aligns really closely with imposter syndrome, and that one being the failure to achieve. So I'm going to read this one, and we can just do me reading it. You'll be able to see how closely it ties to imposter syndrome, So this schema is generally rooted in the sense that you have failed, will fail, or are fundamentally inadequate in comparison to others in areas of achievement. There are associated core beliefs of being stupid, ignorant, untalented, or inferior. This schema might manifest itself through excessive procrastination or relentless driving of oneself, and we see that parallel in imposter syndrome, which we were talking about earlier with the imposter cycle. It creates a lot of anxiety and fear. Often people with this schema often have the sense that they are frauds in the workplace or children in adult bodies. One of the areas that, and I'm going to talk about it in a little bit here, that we see this trait develop, imposter syndrome develop, is in adult children of alcoholics. And because they were typically parentified at a pretty early age and had to take on the responsibilities of an adult at an early age, we see a lot of the characteristics of imposter syndrome develop in early adulthood. And that's something we'll look at as we go through. We talk about the links between imposter syndrome and substance use disorders. So let's look at substance use disorders. And before I link the two together, I just want to review some of the statistics that correlate with substance use, some of the substance use stats. So substance use and misuse and addiction represent a significant and substantial public health challenge. Data from the 2014 National Survey on Drug Use and Health revealed that an estimated 27 million Americans aged 12 or older were currently illicit drug users. 16.3 million were heavy drinkers, defined as drinking 5 or more drinks on the same occasion on 5 or more days in the past 30 days. And approximately 6.5 million people aged 12 or older reported currently using psychotherapeutics non-medically. Just to continue of that, 21.5 million Americans aged 12 or older had a substance use disorder in the past year, yet only 2.3 received treatment. That's about that 10% number that we always hear, about 10% of the people that need treatment are receiving it. Among them, 14.4 million Americans had dependency or abuse of alcohol but not illicit drugs, while another 4.5 million had dependence or abuse of illicit drugs but not alcohol. And 2.6 million had dependence or abuse of both alcohol and illicit drugs. And again, we are seeing the huge uptick right now in the epidemic with the opioid crisis. So these numbers have even grown in the last couple of years, and unfortunately are continuing to grow as we move forward. So I was talking earlier about adult children of alcoholics, and so I want to be able to link those two just for a second with imposter syndrome. Many of the pains that kids who are parentified children carry their own pain into adulthood. It's often not addressed in their children as too much else is going on. After all, remember, these children are young teens and a lot of them are entirely responsible for taking care of the family, and they put themselves last. And that's, of course, because their parents are unable to take care of the family because of their own addiction issues. So as adults, these children are not well versed in how to get all their needs met. So they tend to have mood problems with lapses into depression. They can be their own worst critic. Even faced with small problems, they want to solve those problems now, right now. An adult who has a parentified child oftentimes struggles with a lot of the characteristics associated with imposter syndrome. And I can attest to seeing that a lot here at Lakeview, especially meeting with patients and seeing how many of their parents struggled with addiction, how now they're struggling not only with their own addiction, but a lot of the symptoms associated with imposter syndrome as well. So I want to look at imposter syndrome before the substance use disorder. So what can trigger imposter syndrome to take over? First, we've learned about the childhood, how that can lead into people developing the imposter syndrome, but it can also be triggered as a result of different events. So one thing can be a career. We see oftentimes as people enter into a new career, they start to exhibit a lot of symptoms of imposter syndrome, especially early on until they kind of adjust. Sometimes those traits can become quite distressful, and if not addressed, they can really cause some major distress in a person's life. School, high anxiety, the need to succeed, increased pressure, college, grad school, all those events can be triggering, all those places can be triggering events. Social circles, the pressure to fit in, competition, again, those high stress environments, and of course, multiple areas of the life. So it's not just one of these. It could be a multitude of these things that contribute to the triggering event that leads people to develop some of these symptoms of imposter syndrome. So now I want to look at, if a person has imposter syndrome, some of the unhealthy behaviors that begin to present themselves. The first one would be diligence, and oftentimes we don't think of diligence as being necessarily bad, but it can be if we push it to a certain limit. So gifted people often work hard in order to prevent people from discovering that they are imposters. This hard work often leads to more praise and success, which perpetuates the imposter feelings of being found out. So again, it's that idea of I'm having to work so hard, put in so much effort to achieve the success. So then when I get back to positive feedback, I can say, it's because I put in all this extra work that I'm getting this success. I'm getting this positive feedback. So I still feel like a fraud because I'm having to put in all this extra work. There's also that feeling like a phony. Those with imposter syndrome often attempt to give supervisors and professors the answers that they believe they want, which often leads to an increase in feeling like they are being a fake. If shown evidence of their competence or that they may suffer from a case of imposter syndrome, they tend to doubt themselves even more. The use of charm is a common maladaptive behavior. Connected to this, gifted people often use their intuitive perceptiveness and charm to gain approval and praise from supervisors or colleagues. And they seek out relationships with supervisors in order to help them increase their abilities intellectually and creatively. However, when the supervisor gives them praise or recognition, they feel that this praise is based on the charm that they've been putting on and not their actual ability. So again, they find a way to discredit that positive feedback. The next one's avoiding displays of confidence. Another way a person can perpetuate their imposter feelings is to avoid showing any confidence in their abilities at all. A person dealing with imposter feelings may believe that if they actually believe in their intelligence and abilities, they may be rejected by others. Therefore, they may convince themselves that they are not intelligent and do not deserve success to avoid this feeling. The next one is interesting. I'm going to spend a second talking about this one because this is one of the big links not the only, that we see to substance use disorders as well. So there's active and passive self-sabotage. Now, the active self-sabotage can actually be substance use, creating a substance use issue or disorder, which can be at first kind of a way to mask some of the feelings, mask some of the anxiety, mask some of the depression, but oftentimes we can then use it as a way to self-sabotage the imposter syndrome, self-sabotage their ability to achieve in the workplace. Another way that we see people self-sabotaging actively is not showing up to work on time on purpose, showing up late to meetings on purpose, not completing work on time and doing that on purpose. Passive self-sabotage, procrastinating on something until the last minute, purposely, subconsciously not studying for an exam. That way, if you don't do well on the exam, you can say it was because I didn't prepare for it, and you never really have to test your actual abilities to see how well you could actually do if you put in the effort needed. Failure to complete. This one's just blatantly not finishing your work. So no one ever has a chance to criticize it because it's never done. And then staying under the radar. And I see this one a lot too with patients here at Lakeview, sort of switching careers, switching majors, switching paths pretty consistently, even partners, so that you're never in one place long enough for somebody to actually discover that you're a fraud in the workplace, or someone to discover your belief that you're a fraud in the workplace. So those are some of the unhealthy behaviors that we see. So I'm just checking the time to make sure we're getting through this. So during active addiction, I have about 5 minutes left, so I'm going to push through this a little bit. During active addiction, we're going to see this, some of these maladaptive behaviors quite often. Substance use to escape or mask the symptoms of the imposter syndrome. This is important because this is where the substance use issue can become a real big issue in a person's life. You're starting to feel that anxiety, that depression of being figured out as a fraud. So you use substances to mask those feelings. The imposter syndrome then is exacerbated as your perception becomes reality. As the substance use disorder begins to take over, then your performance at work really does start to drop. So then it solidifies that belief that I am a fraud. That, of course, will in turn feed in or exacerbate the addiction even more. The self-worth deteriorates. Your negative belief system, negative self-talk is solidified. Depression and anxiety can intensify, and then that cycle continues until some sort of intervention is implemented. While in treatment, We still continue to see that demonstration of low self-worth, feelings of inadequacy, helplessness, hopelessness, fear of opening up and being vulnerable or exposed. So when we're in our workplace or when we're in our everyday life and we have imposter syndrome, we put up a pretty big wall because we don't want to be discovered. So in treatment, they present with that same wall. It can take time to really work to break it down. Anxiety resulting from external factors, wanting to get back to work so that you're not figured out as a fraud, things like that. Fear of being judged, and constant negative or irrational thought patterns. Negative self-talk is a big cornerstone of imposter syndrome, that isolation and negative self-talk. Imposter in recovery, so if they make it through treatment, for example, but the core issue, imposter syndrome, that thing wasn't addressed appropriately, it can lead to self-doubt regarding a person's ability to stay sober. A person can start to compare themselves to others in recovery. It can lead to an unhealthy fear of relapse. The unresolved anxiety and depression will linger. Fear of being labeled can result in being dishonest about your recovery, which can be a big issue in early recovery especially. So where do we go from here? The biggest and most important thing to remember is identification. If we can identify somebody that struggles with imposter syndrome and kind of enlighten them to that or shed them insight into how imposter syndrome is affecting them, then they've already won probably the biggest battle in the whole thing. It will put them in a place of feeling very uncomfortable, but at that point we're able to work with them and take concrete steps in order to build up their confidence and allow them to reach higher and higher in both their recovery and in dealing with the depression and anxiety that so closely links or is accompanied with imposter syndrome. So clinical implications, we're going to look at, again, identification being key in treatment. We're going to look at cognitive behavioral, some humanistic approaches, and some schema therapy approaches. Again, the schema stuff pulls from so many different therapeutic approaches, but we will still talk about it a little bit. In terms of cognitive behavioral therapy, this is really interesting because if we go through the whole cycle, I'll just take us through it real quick. You get assigned a task, and your first thought is, I think I'm a fraud, right? I think I'm a phony. I'm not going to be able to complete this task. So that thought creates the feelings, and the feelings are anxiety, depression, worry, and then that feeling leads to the behavior. The behaviors can be procrastination, over-preparation, self-sabotaging, and then those behaviors, of course, reinforce that thought that you're a fraud. You get the positive feedback, you can discredit it, so either procrastination as luck or over-preparation as effort, and you can continue to feel that thought of being a fraud. So what are some strategic interventions? This is cognitive behavioral, identification and acceptance, trying to increase psychological flexibility, that ability to kind of stay in the moment and judge things based on your own core values and the reality of what it is, not allowing your feelings to lead too much down that path. A lot of mindfulness techniques, grounding techniques can be really effective with this. Making sure that the patient is giving him or herself credit, reframing certain irrational beliefs, identifying negative self-talk is really important. Even having a patient journaling when they're engaging in negative self-talk, what did they replace that with? What kind of positive self-talk did they replace that with? Separating feelings versus the reality. So making sure that we're identifying the feelings, yes, but then we're also identifying the reality of it and making sure that we're able to contrast those two things. Inventory negative coping skills, which can be really, really important. The ways we rationalize or discredit positive feedback, we need to make sure that we're inventorying those so that we can replace them with more positive coping skills. And then identifying cravings specific to imposter syndrome so that we can implement coping skills to combat those ones in those particular situations. For humanistic therapy, the goal would be to get more congruency. So you have the ideal self and you have the self-image, and on the left there, we see how incongruent these can be. Somebody with imposter syndrome typically has a lot of incongruencies, so we need to find ways to get more congruency. How do we make my self-image align more closely with my ideal self? And we can do that. Some of those strategies for doing that is we can use is empathy. seeing the world through the eyes of the patient, being warm and acceptance, non-judgmental. We can use a lot of client-centered therapeutic techniques. Client leads the session. Therapist is non-directive. Therapist clarifies responses to promote self-understanding. This is all aimed at increasing self-esteem and openness. If we do challenge, I think challenging is important, but if we do it, we make sure that they're empathetic challenges. We're not going real hard after them or anything like that. The last thing is some strategic interventions using some of the schema therapy techniques. Again, a lot of this is from cognitive behavioral, and this is the last thing I'll cover. So some of the cognitive techniques we can use, diaries, journaling, pros and cons lists, some of the emotional focus techniques. Actually, empty chair technique, role plays can be really effective, especially as we start to look at the history and how a person's childhood has affected or exacerbated that imposter syndrome. Therapy relationship, again, that empathetic confrontation, and then behavioral techniques, skills training, exposure tasks, being exposed to trigger situations so that you can overcome them, things like that. And then this last slide here, again, just in the bottom, the imposter syndrome is what I know in the middle versus what I think other people know. But the reality, and this is what I mean by separating the reality from the feelings. I'm here today talking to you guys. You all could be teaching me something tomorrow. That's kind of the main idea of what we're trying to get each patient to who's struggling with this kind of stuff. In the back here, you guys will be provided with all these slides. I just have some really back to basics, some real simple therapeutic techniques that we should all be using, some strategic interventions, some additional stuff, and lastly, just some tips on burnout, how to avoid burnout, and then, of course, some symptoms of burnout for the clinicians. I think it's always important that we stay up to date. We're doing good self-care for ourselves as well. And then some references here. All righty. So I think I'm going to take a couple of questions. I don't know how many we have, if we have any, but
So as mentioned at the very beginning, in the right-hand panel of your webinar, you should see a questions box. Please feel free to enter your questions there, and I will moderate so that Philip can answer these. First question is, as a therapist, I sometimes feel I don't know what to do. What steps should I take to overcome this?
Yeah, you know, it is interesting. I've given this presentation a couple of times now. And every time I give it, or even talking with some of the people I've worked with in the past, or just people that I meet out in everyday life, if they're therapists at least, they'll express that they've experienced some level of the imposter syndrome at one point. You know, to different distressing levels depending on the person. And it's so common, and even just by knowing how common it is and hearing about, you know, there's a name for it and it exists and it's very real and it's very common that 70% of the population at some point experiences some level of imposter syndrome. Just knowing that, you know, almost provides them with a little bit of comfort. But I would say that a lot of times, especially when it's starting out like a new career or something like that, it takes time to really break through. It takes time kind of assimilating to the new environment, learning how to do everything. And if you give yourself that time and you're open about those feelings you're experiencing, most of the time you can make it through pretty effectively. Of course, if it does become overly distressful, making sure that you're seeking out individual therapy for yourself. I think as therapists, we need to be open to that, very open to that, since, you know, we're preaching the importance of individual care and seeing a therapist. That's always a plus, I think.
Great. We have another question. How often do you see imposter syndrome among the population you serve?
Yeah, quite often. I know that you know, I've been working in substance abuse for a very long time now, and the statistics say, you know, 70 to 75% experience some level of imposter syndrome at some point in their life. I would say with the patients that I see, that number might even be higher. It's so prevalent. And the actual substance use disorder can impact a person's self-esteem and self-worth so heavily that I see it in a lot of patients. And here at Lakeview, we run a professionals program, and I run that group a lot of times. And in that group, even among the professionals, I would say that number is even higher, just because, you know, when you're trying to maintain your life and you're dealing with these fears, this anxiety, the stress, and you have the substance use disorder combined. It's like a perfect storm. So I see it quite often, very often. Absolutely.
What other stats do you have around minorities and women and imposter syndrome?
So I know that I don't have any of the stats right here in front of me, unfortunately. I have looked at it. I know that the numbers are higher, and there's a lot of theory that goes into that. The obvious one being kind of environmental factors that contribute to that, work fairness, things like that. That's actually a really good question, because that can actually, I can answer that in a different way. In the email that I'm going to send you all, or that we're going to send you all, there's going to be a link to a couple articles that I recently found. These are actually dated in June of this year. One's from the New York Times and one's from Time Magazine. And they're all about imposter syndrome, and they talk just about that, actually, women and the minorities and how they're affected by imposter syndrome and some of the environmental factors that make it more difficult for women and minorities in the workplace, and how that can lead to that feeling like a fraud and the imposter syndrome. So we'll include that. I don't have the exact statistics in front of me, though, for it.
Again, if you have questions, please put them in the question box on the right-hand side of the panel for the webinar. One more here that we have. Do you think imposter syndrome stems from childhood, or does it develop in adulthood? When do you typically see this developing?
So I've seen it both ways. I've seen it predominantly develop from childhood, I would say, more often than not. That being said, like a lot of, but you know, my opinion on it's a little bit skewed, since the population I tend to work with grew up in a dysfunctional household, and so that might skew it a little bit, at least in my own perception. I can also share, though, in kind of like a personal story, I guess. When I was sharing my story about it, I grew up in a pretty healthy, at least in my opinion, pretty healthy, well-rounded environment, and it really wasn't triggered, at least the symptoms that I experienced wasn't really triggered until I entered into my field. It was kind of triggered early on, and then I was able to obviously work through it and get to where I am today. So I've seen it both ways, but at least in the population I serve, I do see it develop typically earlier in childhood.
Okay, this is going to be our last question for today. What would you say is also important to talk about cultural factors, such as in the Asian culture, which discourages boasting or standing out?
Yeah. I absolutely think it is. And again, in terms of when we approach each patient or client that we're dealing with, we do have to approach it with kind of that multicultural approach and taking all that stuff into account. Like I was just talking about with that question a few questions ago, women and certain minorities, I absolutely think we need to take those things into consideration and make sure that before we go too far down that road with a patient, we know about their cultural background, we know the norms of that society or that particular ethnicity, so that we're not doing something inappropriate or going about it in an incorrect way. I absolutely think that's very important and something that needs to be looked at. I don't have any statistics on that, very many of the minorities right now, but I'm sure that stuff's available. But yeah.
Great. So just a reminder, we will be sending out an email right after this presentation that includes the post-test and the evaluation. So please let us know what you thought. And thank you so much, Philip, for being with us today. I think that this was very insightful and offered a lot of good tips and tricks for dealing with imposter syndrome within the clinical environment. So thank you so much, and we hope that you can join us again in October or November for another webinar. Until then, thank you so much. We look forward to working with you, and have a great afternoon.
Thank you very much.